talked about social, we are also talking about things like gender-based violence or violence against women, domestic abuse. That is also part of women's health as a broad topic. So we also have to look at that. Then the other diseases that can affect everybody, including women, that's the non-communicable diseases. That's things like hypertension, diabetes, road traffic accidents, all these things. It comes, there's an aspect of it, once a woman is involved, there's an aspect of it that is considered as women's health. About sexual and reproductive health in women, we are talking about any problem or any health concern that comes up in a bid for a person to reproduce, that's to bear children. That's what we are talking about. And right from the onset, you realize that there can be so many problems. The first we can talk about is contraception. When we talk about contraception, it doesn't only mean preventing pregnancy, but contraception as a whole, or now the term that is used is family planning. And what it means is that planning the family, so determining when to have a child or whether not to have a child at all, determine the spacing of the children. When you are about to have children, you want to determine the spacing, whether it's after every 2 years, whether it's after every 5 years that you give birth. So all these things have to do with family planning. When you talk about family planning too, there's another aspect that people usually ignore, and that aspect is infertility, treating infertility. So someone is unable to conceive and you want to help the person have a child. All these things comes into play when you talk about family planning. And studies have shown that family planning can prevent a lot of unwanted pregnancies or mistimed pregnancies. A lot of pregnancies, most of the time, are not planned for. We don't plan them, it just happens, and now after it happens, then we try to see what can be done. So usually it can go two ways. The pregnancy is unplanned and someone decide, okay, I'm going to have an abortion, and it goes to that way, having an abortion. And the second one is that the pregnancy is unplanned and the person decides, okay, I'm going to keep it, but because it's unplanned, you need a lot of resources, you need a lot of emotional support and all that to help with childbearing. Because you didn't plan it, there are some difficulties that can come in. Most of the time, this falls on the women.